physiology of adrenal gland. We have covered the anatomy. So in the physiology, first you need to look at your histological layers of adrenal gland, because when we understand the basic, then we understand what is going to happen next. So let's see. So you know better. So there is the renal gland and this is adrenal gland. So outer part is the cortex and inner one is the medulla. So this cortex is 80% is cortex and your 20% almost is the medulla part. So if you look at the histological layer, so if you magnify them, so the cortex has 3 zones. So this is your zona glomerulosa, and this one is your zona fasciculata, and this black one show zona reticulata, and this yellow one is your medulla. So your major part is zona fasciculata are 78%. So you know better, and their secretion is cortisol type. So the major secretion of the cortex is the cortisol, and as well as the aldosterone and androgen part. So if you look at, so the medulloccorticoid are secreted by the glomerulosa, and glucocorticoid are secreted by fasciculata, and androgen are secreted by the reticularis. So, and if you look at the secretion of medulla, so they are catecholamine, epinephrine, norepinephrine, and dopamine. So they are associated with the stress management. So easier way to remember these layers, GFR. So G represents glomerulosa, F represents fasciculata, R represents the reticularis. So, and for their secretion, so just remember salt, sugar, sex. As you go deeper, you enjoy more. Outer one is the salt, then come the sugar, then sex. So after sex, stress. So you can say medulla is associated with your stress type of secretion. So salt is the medulloccorticoid or sodium management, and the cortisol are associated with your glucose management or glucocorticoid, and androgens are the testosterone and estrogen. Testosterone hormone of the male, estrogen is hormone of the female. So you can see here, so same layers, so salt, sugar, sex, and stress. So these are actually, this is glomerulosa, and this is your fasciculata, reticularis, and stress. So important thing, you must need to remember these layers. So fasciculata secretion and reticularis secretion are controlled by ACTH. Your glomerulosa is not completely under the action of ACTH. It's actually controlled by the RAS system, Renin-Angiotensin, Aldosterone system. So same thing is mentioned here. So ACTH control these layer inner zone, which is the fasciculata and the reticularis, and the outer part, which is the glomerulosa, is under the action of Renin-Angiotensin, Aldosterone system. So also there in the basic, in the synthesis, is ACTH involved, but later on they are under the action of the RAS. Okay. So here is secretion is mentioned. Aldosterone is the major secretion of medulloccorticoid, and glucocorticoids secrete cortisol, corticosterone, cortisone. While if you look at the androgen, so they secrete your dihydroepiandrosterone. These are actually your the androgen type of hormone. So if you look at the adrenal medulla, so their secretion is epinephrine and norepinephrine. So stress hormone. So their stimulation is under the autonomic sympathetic nervous system, while these two are by the ACTH, and this one is by the Renin-Angiotensin endocytosine system. Okay. So now see the hypothalamic-Pituitary Axis. So because when we discuss, some first we try to identify their structure, then we look at the regulation, how they are secreted. So their regulation is by the hypothalamus-pituitary axis. So if you look at, so hypothalamus is by the diurnal rhythm or 24 rhythm or the physiological, emotional and biochemical. So these actually factors stimulate the hypothalamus to secrete the CRH. So when the CRH is secreted here, so they affect the anterior pituitary. So this anterior pituitary secrete the ACTH, and this ACTH going to the affect the your adrenal gland. So this adrenal gland actually by the PKA mechanism or cyclic AMP pathway system. So they perform their job and increase the intercellular calcium and physiological action. So they eventually at the end they secrete the secretion of fasciculata or your reticulatory system. So in this way this pathway is actually created. So when there is too much secretion, so they give negative feedback toward the hypothalamus. So they stop the CRH, the ACTH secretion. So in order to stop the further secretion. Okay. So same thing is mentioned here. So use the cyclic AMP pathway and the second messenger system as so CRH and ACTH are controlling the your cortisol secretion. So and feedback mechanism. Long loop is if they affect the hypothalamus or pituitary, so it's a long loop. A short loop is what? So they stop their own gland. So if they send negative feedback to their own gland, this is your short loop type. Okay. So so now come to the structure of basic structure. So because it help us to identify a lot of clinical conditions. So if you look at the so they all saturated are actually coming from cholesterol. So all saturated hormone we are going to discuss associated with the saturated. So their cholesterol nature. So if you look at the cholesterol structure, so there A, B, C, D and 4 ring are mentioned here. So actually overall total number of the carbons of cholesterol are 27. So if you look at so 20, 21, 22, there all are 27 carbon. So their side chain are present. So if you look at the structure of the saturated, so they look like the cholesterol. So if you look at what is the comparison, if you compare the structure, so if you look at the cholesterol structure and with the cortisol, you will see same 4 rings are present, but you cannot see the side chain, larger one which was 27 carbon containing. So the carbon will chop off, so cleavage occur. So we have removed some carbon, the side chain. So here are 21 carbon are actually present. So and other difference occurs. So there is a ketone present here and the hydroxyl group present here and hydroxyl group present here. So this is some modification occurs when cortisol synthesis occur. If you look at the cholesterol with the aldosterone, so you will see double bond, one double bond present here, other double bond comes here. So and your hydroxyl is present and hydroxyl is also present. So if you look at the androgen hormone, you will do not see that 20 and 21 carbon. Can you see here? No, 21 and 20 is removed in the androgen. So overall concept is that so this is your saturated or 21 saturated carbon containing. So they are actually glucocorticoid and mineralocorticoid. Well, in case of your androgen, so they are 19 carbon containing molecule. Okay, because 20 and 21 has been removed in their structure. So if you look at here, so same thing is mentioned. This is actually the description. If you look at glucocorticoid, they contain ketone group at carbon 3 and hydroxyl group at carbon 11 and carbon 21. So if you look at mineralocorticoid, they are similar but double bond is present at carbon 18. And so in androgen you do not have 20 and 21 carbon. So same thing is, so ketone is at carbon 3, hydroxyl group present at carbon 11 and carbon 21. So, and if you look at the aldosterone, so they have same ketone group and the hydroxyl group, and but so they have an extra the double bond at carbon 18. While in case of androgen or DHA, so you do not see that 20 and 21 carbon, you have 19 carbon. So two other extra carbon has been removed. So let's look at their synthesis. So they are coming from cholesterol. So they are actually, cholesterol is coming from actually lipid droplets because it's part of the, so LDL actually provide the, so this removed cholesterol is replenished by cholesterol in the LDL, which is coming in the blood. So this cholesterol in the blood bind to LDL protein and the receptor for lipoprotein in the membranes of adrenal cortex cell, and the lipoprotein cholesterol complex bind to the receptor and transferred by the endocytosis system. So this is actually, so our star proteins, so they can so these are actually our sources of cholesterol. So different sources are mentioned, you can read it later. So steroid are synthesized when their stimulus come on demand. So they are not stored, you know, but peptide are stored, while these are cannot be stored. So the first step is the conversion of, so important thing is that the first step in their synthesis, cholesterol converted into pregnenolone. So pregnenolone actually remove the, so because we have 21 carbon, while in case of cholesterol we have 27. So we remove the 6 other extra carbon by this cholesterol desmolar. So this is first step in their synthesis. So, and newly synthesized steroids are rapidly secreted from the cell. So they are actually, travel in the blood in form of bonded protein. So they need a carrier. So their carrier could be albumin or CBG, corticosteroid, or if you look at the androgen, sex binding globulin is present. So corticosteroid binding globulin or aldosterone binding globulin. So depending upon the cell, so their name is the binding protein is similar. So important is, so first step is cholesterol. All are the precursor, and their first step in their synthesis is the cholesterol desmolase, which will chop off the other extra carbon. So, and this enzyme is actually active for their activation. Need the cytochrome P450 molecular oxidant NADPH, which actually hydrogen donor. So these are some description, you can read it. But important thing, you just follow the pattern, what's happening. So steroid hormones. So if you look at the first, we are going to look at the glucocorticoid hormone synthesis. So first step is cholesterol desmolase, and the second step we need actually hydroxyl group at the carbon number 11 and carbon number 21 in case of cortisol, and other is the hydroxyl the double bond is needed. So three things are needed. Two are the hydroxyl group and other ketone group needed. So that's why we use hydroxylase, so which will put the hydroxyl group, and we need another dehydrogenase, so which will convert the hydroxypregnenolone into progesterone, and finally 21B hydroxylase and 11 beta hydroxylase put the hydroxyl group at carbon number 11 and carbon number 21. So interesting. So these steps are actually order is similar, simple, but sometimes this order can be disorganized. So first some step occur first and some occur later. So although this is normally this pattern is followed. First desmolase come and alpha 17 alpha hydroxylase 3 beta and 21. So if these are stopped, so their secretion not much different. Let's see. So what's happening? So for example, here is, just look at the picture. Inshallah, you will understand what's happening. So here is cholesterol. First step, what will happen? Pregnenolone will be synthesized by the cholesterol desmolase. Okay. So in this step, your extra carbon has been removed. So this step is actually stimulated by ACTH. So we see when we discuss the ACTH is going to stimulate the secretion. How they stimulate? They actually stimulate this first step, this hormone. So in this way, pregnenolone in synthesis, either the discussion of aldosterone or cortisol, your first step is under the action of ACTH. Okay. So let's see. For example, this side I am showing your first layer, that is glomerulus, and here I will show the fasciculator layer and the reticular layer. So their synthesis. Let's look. So pregnenolone converted into the progesterone. So they need the hormone which is used is 3-beta hydroxysaccharide dehydrogenase. So and these enter into the fasciculator layer. So they need another hormone. So they are converted into 17-hydroxypregnenolone, 17-hydroxyprogesterone. So they need another hormone. So they can be converted into each other, same hormone but 17-alpha hydroxylase. Hydroxylase means associated with hydroxyl group. So 17-hydroxyl group and 17-hydroxyl group, they convert into this, they convert into this. So they can be interconverted into each other. So if this hormone 17-hydroxyl is not present, so they cannot convert into this pathway. So let's follow the picture. So what is it? So then we need 21-hydroxylase, which will convert into deoxy corticosterone and then convert into corticosterone by alpha beta 11B hydroxylase and aldosterone. So this aldosterone synthesis is important in the aldosterone synthesis. So they are actually stimulated by your RAS system. So if you look at here, same thing is happening, just this converted form is present here. So before moving further, you need to understand what is happening. Your first step for the cortisol for the aldosterone is under the action of ACTH. While if you look at the aldosterone synthesis, they are under the action of RAS system. So this aldosterone synthesis is stimulated by this. So the question is why we cannot synthesize aldosterone in the fasciculator layer, because this hormone is absent in here. So we cannot synthesize this one, aldosterone in the fasciculator. So that's why the aldosterone synthesis in the first layer and cortisol synthesis in the second layer, and your androgen are synthesis of in third layer. So important is their hormone, where their enzyme is present. Enzyme is present, so they can be synthesized. Here is in this layer aldosterone is missing. If you look at the cortisol, while cortisol cannot be synthesized here because these hydroxylase and hydroxylase are not present here. So other important concern. So this last three one. The dog is in short form deoxycorticosterone and corticosterone and the aldosterone. They all have mineralocorticoid type of activity. So if you have an idea of the action of mineralocorticoid, so they cause the reabsorption of sodium and which is followed by the water reabsorption and the excretion of two things. One is your potassium ions, other is the hydrogen ion. So they reabsorb two things and release excrete two things. Excretion of sodium, potassium and hydrogen ion, while the reabsorption of sodium and water. So all these three can do this mineralocorticoid activities. So if this one is missing, so they can perform the job of mineralocorticoid. So if this hormone is absent, if their blockage is here, so we are not much, our mineralocorticoid activity is not much affected because this mineralocorticoid is present. So if the damage is above here, dog, so you will lose the mineralocorticoid activity. Mineralocorticoid, which is actually associated with blood pressure maintenance. So by these functions, so you lose the blood pressure maintenance. So may lead to death. So if these hormones are all three are missing, okay. So if you look at here, so if you do not have 21, so you will. So how we can identify which hormone is missing? By simply looking at it. So if this hormone is missing, mean this will be synthesized more, so their concentration will be high. So if this hormone is missing, corticosterone will be high. So by the precursor, we can identify which hormone is missing. Okay. So if you look at cortisol is here, so this is your and the other. So this step is actually your. If you look at last step, so this alpha lemon beta is inhibited by. So there by some drugs which are used to inhibit if we do not want to cortisol activity more. So we inhibit this step. So if you give the metropone, it will inhibit the last step, while the ketoconazole, so they inhibit the several steps of their synthesis. So in this way we can set up the cortisol synthesis, we can decrease their secretion. Okay. So if the alpha is blocked, fetch beta still can cortisol without the, so this thing is mentioned. So your zonophageal acetyl can produce corticosteroid without the detritus effect. So this thing is actually mentioned. So if your 17 alpha hydroxylase is missing, so this cortisol can synthesize this one, because they do not need all hormones are present. So this one is, if this is missing. Okay. So this is glucocorticoid synthesis. If you look at the androgen, in which we have mentioned, so they do not have 20 and 21 carbon. So these mineralocorticoid and cortisol have 21 carbon. So for the androgen synthesis, we need to remove 20 and 21 carbon to make the 19 carbon molecule. So these actually the androgens are important in the female case. If you look at the male, so they have testes, so they can synthesize the androgen. So if there is problem in the adrenal cortex, so they can synthesize by the testes. But in female case, when there is no testes, so their major secretion is coming from the adrenal cortex. So if these androgen are affected, so they may affect their menstrual period or the action of the androgen hormone. So you will see such kind of condition. So this thing is mentioned in male, testes produce their own testosterone, while in case of female, only they are majorly dependent on the adrenal cortex. So we need 17 hydroxypregnenolone, and for the precursor we use same 17 hydroxy, which will, and eventually we need to remove the 20 and 21 carbon. Let's see what is happening. Adrenal cortex have, and they have ketone and 17 carbon. So distinguished from the cortisol, aldosterone and testosterone. If you look at the adrenal, and the testosterone has hydroxyl group at 17 carbon. So thus the major androgen are the 17 ketosteroids. So their name is 17. Let's see what is happening. So same pathway you know better. So I'm not going. We have covered up till here. So let's see. We need these two precursors to enter into the androgen layer. So we are entering into the androgen layer. So we convert this 17 hydroxypregnenolone into DHEA. Dehydroepiandrosterone. So these all are the precursor of androgen hormone. So 17 and 20 lyase is needed to remove your 20 and 21 carbon. So they can be interconverted. So same hormones are used. So if you look at here, so 17 beta hydroxy dehydrogenase is needed. So in this way, by these layers 17 and 20, we have removed 2 extra carbon. So here is 19 carbon molecule. These two are the 21 carbon molecule. So importantly, if you lose these enzyme allow to enter into the fasciculator layer, and these are allowing to enter into the reticularis layer. So if you lose these hormones, your aldosterone secretion will be increased. So pathway enter into this. So if you lose this pathway, these two secretion are going to increase. Okay, if you stop these hormone secretion, so they are entering into the androgen. So their androgen secretion will go up. So in this way, they have different effect by the deficiencies. So they're actually the step 1 exam majorly test. Their test is on this. So 17 alpha is absent, what will happen? 21 is absent, what will happen? So you need to understand. So if these pathways going stop, this secretion will go up, and if this is stop, this secretion will go up. So if you have these hormones are missing, so your androgen hormone are going to have. So androgen or testosterone. So their androgen synthesis or testosterone synthesis occur here. So but the conversion of androgen into the estrogen is not occur in the adrenal cortex. So they are occurs in their gonads. So where they have an other hormone aromatase. So this testosterone by the aromatase converted into the estrogen. Okay. So if for easier way to remember, so testosterone male hormone synthesis first, they converted into female hormone. So for becoming female, so they have to cross the male. Okay. So mineralocortical synthesis only the glomerulosa and this type of cholesterol into corticosterone, and in case of zona fasciculata and addition. So there is why they are synthesis because we have aldosterone synthesis in the glomerulosa layer. And other thing why they cannot be synthesized the cortisol, because they lack of 17 alpha hydroxylase hormone, which is needed for the cortisol synthesis. So that's why our the hormones of glomerulosa are secreted in the glomerulosa, and the hormone which are the glucocorticoid are synthesized in the fasciculata. So if we put these hormones, these enzymes of the fasciculata, so they can secrete this. So the major difference, there is not structural problem. So there is missing of hormone. So some hormone are present, aldosterone are present in the glomerulus. The enzyme for the cortisol are present in the fasciculata. Enzyme needed for androgen synthesis are present in the reticularis layer. Right. So, and we have discussed this. If the aldosterone is not synthesized, so 11 dog or corticosterone can perform the mineralocorticoid activity. So if you aldosterone, so but if you block the both one, so then you lose the if the block is below the dog, so mineralocorticoid will be produced. If the block is above the dog, mean there is no dog, corticosterone, aldosterone, so you lose the blood pressure balance. Okay. So this is all setup. So this is so if their block is here, if at this setup you will lose the mineralocorticoid. So if the block is below the dog, you will not much affected because this can perform the mineralocorticoid activity. So this is actually all things are mentioned here. So first step, synthesis part there. So the ketoconazole stop this step, and if you look at these other drugs, the anastrozole and the letrozole or exemestane, so they stop the aromatase synthesis. So you can see here testosterone enter into the peripheral tissue where they convert into the estrone or estradiol and finally convert into the estrogen. So these drugs actually stop the conversion of testosterone into the estrogen. So because their synthesis is not occurring in the adrenal cortex, estrogen synthesis will occur in the peripheral tissue. And these are metropone which stop this step, so glycerin, tanic acid. So there are different drugs are actually mentioned which can stop the different step, which will inhibit the synthesis of your, if you want to stop the differences. So their pharmacological importance. So one more important which I think we are missing. So your which step is actually rate limiting step. Your first step, which is cholesterol into pregnenolone conversion, so which is under the cholesterol desmolase activity. So this is a rate limiting step. So which is controlled by the ACTH. So cholesterol desmolase is actually your the first step of the synthesis of your all step, because when we have converted into pregnenolone, we can continue the synthesis of aldosterone, we can continue the synthesis of cortisol, so and androgen. Okay, so first step is actually your cholesterol into the pregnenolone conversion is your rate limiting step. So this is mentioned here. So if your 17 alpha hydroxylase is missing, your mineralocorticoid will be high. And when your mineralocorticoid high means your activity of mineralocorticoid will be high. So that's why what is the activity of the mineralocorticoid? So they cause excretion of potassium and excretion of your hydrogen. So such kind of patient will present with the hypokalemia, mean low potassium, and if you have lose the hydrogen, mean you are going to alkalosis condition. So when there is hyperactivity of mineralocorticoid, so and your blood pressure will be high because more sodium and more water has been entered. So blood pressure level go up. So if you look at the hormones, other hormone secretion will be go down, cortisol activity. So androstenedione and the presentation are ambiguous genitalia because no androgen are going to synthesis. So our synthesis has been increased of mineralocorticoid, first layer. So and your excess like the secondary sexual development because they need androgen, because we have mentioned in case of male the testes can synthesize them, but in case of female only source is the adrenal cortex. So if you have lose this hormone, mean you are going to increase the mineralocorticoid activity and other two layers go down. Okay, so if you look at the 21 hydroxylase in which you lose this synthesis of the mineralocorticoid. So when you lose the mineralocorticoid, mean what? You are not excreting potassium, means your potassium go up, hyperkalemia, and your hydrogen ion go up, mean acidosis condition, metabolic acidosis, and your cortisol are low, and the other, and if you look at the blood pressure will increase or decrease when there is when there is low mineralocorticoid.
When there is low mineralocorticoid, blood pressure decrease.
Blood pressure will decrease because they are actually maintaining the blood pressure. So when their mineralocorticoid high, blood pressure high. When their mineralocorticoid down, blood pressure go down. So their patients are most common present in the infancy, salt wasting, losing the salt, and because they are not reabsorbing them. So childhood, precocious puberty, and the virilization in the female because there are other hormones. When mineralocorticoid down, mean androgen are high. So androgen high mean they cause virilization in the female especially. Not affected the males much, so female are mostly. If you look at the 11 beta hydroxylase deficiency, in which you have less number of aldosterone and your in next step what will happen, your the dark will go up. So you know better when there is and this is actually in the last step. So your dark will up, dark do same mineralocorticoid activity. So that's why your blood pressure go up in this condition and your potassium go up. So because the dark is performing the job of mineralocorticoid. So cortisol go down and the hormones, other renin activity go down because aldosterone are down by the renin activity. So because they are controlled by the ROS system. So when the ROS system go down, activity go down, aldosterone go down, and these are present in the infancy or childhood, precocious puberty, and virilization type of secretion. So all congenital adrenal enzyme deficiency are autosomal recessive disorder. Most are characterized by sucking hyperpigmentation. So if you recall when we discussed the pituitary, so we have discussed there the ACTH have POMC derivative. So when actually POMC derivative, in the POMC derivative, ACTH was included and MSH was included. So when the ACTH stimulate more, we want to increase the ACTH secretion, we actually stimulate the POMC, because there you can see the children of POMC are the ACTH as well as your MSH. So when you increase the ACTH, eventually other children will grow up, MSH go up. So that's why when there is a hypersecretion in case of Addison disease, so such kind of have a hyperpigmentation on the body, because when ACTH increase, our MSH both will increase. So that's why their Addison patient have hyperpigmentation on the skin, so pigmented skin, because MSH is melanin. So they cause it darkness of skin. So Addison, one of the finding of the Addison patient is that. Okay. So so that's why they are present with the hyperpigmentation due to high MSH production, which will co-produce the secreted with the ACTH. So as the ACTH produce, MSH also produce. So and bilateral adrenal gland enlargement. So because when there is ACTH high, so they affect the gland, they cause the enlargement. So if deficiencies in start with the primary, it causes the hypertension, high blood pressure, and if deficiencies end with the primary, it causes the virilization in the female. So this is regulatory system. You already know hypothalamus and the pituitary, and here is the adrenal cortex. So hypothalamus secretes your the CRH. So CRH affects the anterior pituitary, which will secrete the ACTH. ACTH going to affect the adrenal cortex. So lower two layers. So they cause the gluconeogenesis, protein, fat metabolism. So there are different activities with cortisol. But this cortisol can inhibit the pituitary to stop the ACTH secretion and stop the hypothalamus. So other major concept which really tests all kind of your hormone is what is difference between the primary hypersecretion, primary and secondary. So if their problem is in the gland, meaning there is problem in the adrenal cortex, so secretion is affected or hyper or hypo, so we name them the primary hyper, for example cortisol or any other condition. So if there is problem in the gland which is secreting the hormone, for example cortisol related, so secondary is what? If this ACTH, which is controlling the adrenal cortex, so if ACTH go up, it will cause the secretion of adrenal cortex. Okay, so if ACTH go down, means their adrenal cortex secretion go down. So if the problem is with the ACTH, which is controlling our gland, so if there is a hypersecretion or hyposecretion in the pituitary or the hypothalamus, so such kind of we call them the secondary. If there is problem in the adrenal cortex, for example adenoma or your cancer in the gland, so they cause the high secretion, not affected by the ACTH. So we name them the primary if the problem is the gland. Secondary is what? Problem in the controlling system. Okay. So you need to clear these terms. CRH, so their secretion is actually pulse type. So if you look at the other thing, so there are actually 10 cortisol, which is actually important in the gluconeogenesis or glucose. We see later their function. But if you look at secretion, so there are 10 bursts of the secretion. It's not secreted. We have already mentioned they are not continuous, they are pulse style nature. So if you look at the cortisol, there the cortisol level is high in the morning and go down in the night time when you sleep. So that's why actually when we awake in the morning, so half an hour before that, for example, if you have habit of awaking at the 7 a.m. So half an hour before the 7 a.m. our cortisol go up, which will cause the gluconeogenesis and provide the energy to the body. So adrenal cortex secrete the cortisol, which will provide the energy when our whole body is energized. So there is no need to someone come here and wake up me. By the habit. So if you look at elder person, so they awake at the 4 a.m. They no need alarm because their rhythm is set like that. So cortisol go up, which will energize the body, and we wake up. So if this is followed by the habit, so there are actually 10 bursts of secretion. So in the 24-hour period, so there is lowest at the midnight, and there is highest, for example, at the awakening time in the morning. So major burst of cortisol before the awakening account for the 1/2 of the total daily. If you look at the secretion of count the secretion of cortisol throughout the day, your 50% is secreted in your morning time. Okay. So other adrenal androgen are secreted in similar burst. So they follow the same pattern. ACTH secretion also exhibit the. So this is actually secretion of ACTH. So which will control the cortisol because they are stimulated by the ACTH. So they follow same diurnal pattern. So if you look at the ACTH, we can say there if someone asks the rhythm of this, so your ACTH level will be high in the morning and lowest at the midnight time when you are sleeping. Okay, so you can see here. So their secretion is high at the 8 a.m. while lowest at the 12. And if you look at, so they're high in the morning and go down at the night time. And when you reach the morning time, again your cortisol or your other pattern go up. So these are actually also showing your CRH secretion, also showing your the ACTH secretion because they are stimulatory, which controlling this hormone. So plasma cortisol level ranges between the 20 per gram per deciliter an hour before arising in the morning when you wake up in the morning. So their secretion is such, and low in the late afternoon, which become the 5. So at the afternoon time, their secretion is 5 picogram per deciliter at the midday, while 20 in the morning. So these affect actually our daily life activities. Okay, so when a person changes daily sleeping habit, the cycle change also correspondingly. So if you want to, if you try to awake to follow the habit of awakening at 4 a.m. 2 or 3 days, eventually after this you automatically awake at 4 a.m. because of this pattern of your secretion of cortisol. Okay. So if you look at we have discussed the cortisol. So let's look at the adrenal cortical. The adrenal cortical, which are for example aldosterone. So synthesis and secretion by the adrenal cortex depend upon the stimulation of cholesterol desmolase, which is first step. Better is the renin-angiotensin center, and by the ACTH. In the absence of ACTH, biosynthesis of these hormones stop, because when you stop the renin-angiotensin center, you stop the secretion. So two questions: what regulates the secretion of ACTH, and the other is what special regulatory factor control the function of zona reticularis, fasciculata, and glomerulus. So our first question is, what are the factors which actually controlling the ACTH secretion? So which will decide the acetate they need to secrete, they need to decrease. So there are different factors which are actually controlling this. So first step is and if you look at the glomerular, which is actually by the renin-angiotensin, which will decide they have to secrete the aldosterone. While in case of other two layers, which are actually controlled by the acetate. So our question is, what are the factors which give signal to acetate to secrete the hormone or stop the secretion? So let's see the factors. So these are actually stimulative factors, these are inhibitory factors. So for example, if you decrease blood cortisol level, so cortisol is low, so ACTH will be stimulated to increase the cortisol level. In the sleep-wake transition, if you're awakening, the cortisol have to increase, so ACTH go up. When you're at the sleeping time, your ACTH go down. So stress and hypoglycemia, stress can become, you know better when we discuss the growth hormone, we mentioned the growth hormone, cortisol, catecholamine, epinephrine, so they are stress regulatory. So they maintain the stress by providing the glucose or energy, you can say. So that's why when stress condition or you have the one of, for example, hypoglycemia condition in which you have low glucose or in surgery or any trauma, so they also increase the cortisol and your psychiatric disturbance or your ADH. So alpha adrenergic agonist or beta adrenergic antagonist. So serotonin. So these factors stimulate this. If you look at the inhibitory, for example, if you have a high level of cortisol, there is no need to secrete more. Okay. So opiates and somatostatin, which is universal inhibitor. So these factors are actually inhibiting the decide the acetate to secrete or stop the secretion. Okay. So regulation. So there is actually, if you look at the cortisol, we have which will help the acetate to decide the function. So there are actually three pathways. First is they directly inhibit the CRH, which is coming from the hypothalamus. Other pathway is they affect the your limbic system, in which hippocampus. So hippocampus gives signal to the your hypothalamus to stop the CRH, to stop the ACTH secretion. And the third way is the cortisol inhibit the action of CRH on the pituitary action. So and resulting in the inhibition of ACTH. So we have three pathway cortisol. One is directly inhibiting the CRH, which will stop the secretion of ACTH. The second is they stimulate the limbic system, which will stop the CRH secretion. The third way, they stop the effect of the CRH on the pituitary. So mean if you have stopped the function of the CRH, means your ACTH secretion will stop. So in this way there are actually three pathways of cortisol which are going to regulate. So chronic deficiency of cortisol lead to stimulation of CRH and ACTH axis in order to increase the ACTH level, and chronic excess of cortisol will inhibit the CRH and ACTH, decrease the ACTH level. Okay. So if you look at there, we have already discussed the zone of vasculature and reticulation are completely by the hypothalamus-pituitary axis, while the glomerulus is only first step is under the action of ACTH, while all other steps are by the renin-angiotensin aldosterone system, because the last step which was important in the synthesis. So you need to careful these things. So if you look at the mineralocorticoid regulation, so which is really aldosterone secretion mean. So if you want to, when there is low blood volume, because the function of mineralocorticoid is to increase the blood volume. So when there is low blood volume, your mineralocorticoid secretion go up. In other, which is really important, is this rising blood level of potassium when there is hyperkalemia, because the function of mineralocorticoid cause the hypokalemia, because they excrete the potassium from the kidney. So because if for example, if you look at, for example, an accident, so you see the accident and you have seen the patient has been dead in next few minutes. what happening? So first factor which actually cause the death of that patient is the high level of potassium. So because when there is high potassium, it actually potassium effect is on the cardiac, on the heart. So when the potassium go up, or hyperkalemia or hypokalemia, so they affect the heart, they cause the fibrillation of cardiac rhythm. So in next few minutes, when the cardiac rhythm is disturbed, patient will die. Sodium effect on the CNS, while the potassium affect the cardiac. So the hypernatremia or hyponatremia not affect the cardiac. So they affect actually the brain. So that's where our death, if you want to point out what is cause of death of that patient, that is the potassium. So that's where when there is hyperkalemia, so eventually in next few minutes, in next few seconds you can say renin-angiotensin system activated, cause the secretion of aldosterone to maintain the potassium level. It's really important to maintain the potassium level. So rising of blood level of potassium is, we can say, is the major stimulatory step in the aldosterone secretion. While ACTH and your low sodium, they can, but the major is this one. Okay, so when there is low blood sodium, because their function is to reabsorb them. So when there is low sodium, we need aldosterone to reabsorb the sodium back. So this is if you look at the renin-angiotensin system. So this is actually a last step in the discussion. So if you look at the renin-angiotensin, so actually angiotensinogen is coming from the liver. So this angiotensinogen is converted into angiotensin 1 by this renin, which is coming from kidney. So and this angiotensin 2 converted into angiotensin 1 is converted into angiotensin 2 by another enzyme, that is the angiotensin converting enzyme by the lungs. So if you follow the pattern, angiotensin is coming from the liver and renin cause the conversion of the angiotensinogen into angiotensin 1. So and other enzyme coming from the lungs in the bronchi. So they cause the angiotensin 1 into angiotensin 2 conversion. So this angiotensin do what? They stimulate the aldosterone secretion and they perform their jobs. So this is same pathway. So we have discussed the decreased sodium and increased potassium stimulate this and decrease blood volume or blood pressure. They can also stimulate this pathway. So increased blood volume and increased blood volume can inhibit. So by actually they are stimulating the ANP system, which will set up the aldosterone escape system, which will set up the function of the aldosterone system. So this is a discussion of our adrenal cortex. So in the next segment we will do the function of the cortisol, the aldosterone, and their pathophysiological relationship with them.